Hello everybody, this is Dr. George Ragu from AdoptionDoctors.com. Today I'd like to speak to you a little bit about the domestic adoption of the opiate-addicted infant. In the U.S., the opiate addiction and other drugs have become the leading cause for the removal of a child and the termination of the parental rights of the biological mother or father. Foster care and domestic adoptions have become a way to remove the infant from the child from the harmful environment and place the child with a loving family, giving them a chance to a more normalized lifestyle. Drugs that are frequently used during the pregnancy of expectant mothers are as follows. The illegal ones, such as opiates, heroin, methamphetamines, marijuana, crack, and cocaine, and prescription withdrawal medications, such as methadone and Suboxone. Some of the immediate short-term impacts of opiates, oxycontin and oxycodone ingestion during the pregnancy is sometimes the cause of neonatal abstinence syndrome, or NAS for short. These infants are born addicted to narcotics, and once the umbilical cord is cut, the supply of the drug, the fix, is immediately stopped, and the newborn begins to go through withdrawal symptoms as an adult would. The withdrawal symptoms of the neonatal abstinence syndrome, or NAS, include being more tremulous or jittery, difficulty with sucking, swallowing, causing feeding issues. There are also some issues with loose stools, and in severe cases, seizure activity. These infants are generally uncomfortable and irritable all the time, immediately after birth often. The self-regulation is always a problem for these infants. They are oftentimes difficult to console, present with colic-like behavior, or are just never able to settle down. The seriousness of the withdrawal symptoms. It is dependent upon the severity of the ingestion. Babies born to true addicted parents have the biggest risk of seizure activity and pauses in breathing, or otherwise called apnea. These infants need to be monitored in the neonatal intensive care room setting. Withdrawal generally occurs right after birth. The treatment is comprised of therapy with a tincture of morphine to alleviate the withdrawal symptoms, and the dose gets titrated downwards as the symptoms improve. If an adopted infant is born dependent, therapy could take 72 hours to 3 weeks duration to come down from the withdrawal. Sometimes, if there is a reliable caregiver, the infant can be sent home and the morphine wean can be prescribed by the physician, and the parent does it as an outpatient. Every baby is infant, so each case needs to be individually determined. The morphine therapy is given in a liquid form. Now, in order to follow the symptoms, we use an objective rating score called the Finnegan scale. Some of the long-term effects of the opiates exposure areas of these children grow into toddlers and preschoolers that could impact the early childhood development. They have slightly lower developmental scores in the psychomotor and cognitive abilities, slightly lower language scores, and increase in attention deficit disorder. For mothers that are on methadone or Suboxone therapy during the pregnancy, it helps the mother, for it no longer has a half-life that takes more time to leave the body, but to develop an infant brain. An opiate is an opiate, so there is no protection from that. Some of the long-term and short-term outcomes for methadone and Suboxone therapy. The long-term and the short-term outcomes for methadone and Suboxone are the same as for any opiates. The only protection that the treatment medication is that the mother is not using injections during the pregnancy, injected drugs during the pregnancy, and she's not spreading blood-borne disease to the infant. Things that will help the child that has suffered from neonatal abstinence syndrome in the early intervention services, such as physical therapy, occupational therapy, and speech therapy. With the right therapy in the early years of development, the baby's brain can be rewired. The prenatal exposure to drugs is a risk factor, but it does not mean that every child will have long-term effects. This could be because part of the brain that is impacted in the early part is not fully functional until later life. A stable, structured, nurturing home, as well as early intervention, can help the child that has suffered from early prenatal exposure to drugs. And this will help to alleviate some of the long-term negative outcomes.